Mistake number two that clinicians often make is that they pitch their practice as a luxury and not a need, and they don't even realize that they're doing this. All right, they put so many beautiful images on their website, and it just looks like something that a wealthy person is going to spend a lot of money on, as opposed to something that offers a meat and potatoes solution to a problem that they have. All right. So if you pitch your service as a luxury, clients may feel that your health and wellness clinic is for wealthy people only. Also, if it looks like a luxury, they're not going to prioritize it. People do what they have to do before they do what they want to do. Right? If you have multiple sclerosis and you are you know and you there's an existential threat to your life, right? You could die from it, right? You are going to prioritize that. And if your clinic looks like it's a luxury practice where you can relax and get rid of some stress, they might not your clients may not prioritize that. Now, of course, you can build a whole clinical practice around stress reduction. That's different, right? Like then your main service is helping people who have inordinate amount of stress, and that's your whole focus. That's fine. But unless you're focused on stress reduction as the main primary thing of your clinic, putting relaxation images and all those things on that may make your practice look like a luxury practice instead of a need to them. And that may reduce their budget for you. All right, so some examples that communicate a luxury purchase. Spa imagery. We all know the classic in Ayurveda, the classic picture of the beautiful young woman on a massage table with oil dripping down her back. It's like the biggest Ayurveda cliche. And one way to make sure that your practice is literally no different from anyone else's practice in our entire profession, right? Because everyone's putting that message out there. If your clients are looking for a practitioner, they're going to see that same picture on 15 different websites, and they're going to be like, okay, which one is the best for oil? That's hard for them to tell. They're not going to be able to see because everyone's saying the same thing, right? In general, heavy use of cultural, spiritual symbols or lifestyle symbols are going to make your practice appear more like a lifestyle choice rather than a medical benefit choice. Take a look at this photo here. And this is actually an appropriate ad, I think a really effective ad because they're marketing health tourism here, right? Which is it is to a wealthy crowd, and it is to a retreat center, and so they're trying to get people to travel to India. That's a little different than say you marketing a clinical practice in your town. And again, by the way, I just want to make it clear, I'm not talking in this discussion tonight how to market a retreat center or how to market if you're like a spiritual guru or something. I'm not talking about your practice either. I'm talking about marketing a clinic, right? And so what is it going to take to get patients into your clinic? So I'm focusing on medicine here, and this presentation is targeted to that. So when I look at a photo like this, I think of something that I could do, not something that I have to do, right? And so it appears to me like a luxury thing. It's very beautiful. It's a little bit sensual, natural, all these themes in there. It can be very attractive, but it doesn't necessarily communicate a medical practice or that you're going to solve a life or death situation for a client, like a client with MS or someone who has a real need, chronic acid reflux or chronic constipation, and they just feel awful. You don't even know whether you're gonna this ad isn't telling you about whether it can even help your constipation, right? Okay, so a heavy use of cultural, spiritual symbols or lifestyle or spa imagery, or even a lot of focus on mental wellness, unless it's the focus of your practice, is going to sort of make your practice look a little bit more like a luxury than a need. And there's one of those classic Ayurveda pictures. There's no oil in this picture, but you see the young woman, flower in the hair. It looks like a spa. And spas are wonderful. If you're marketing a spa, absolutely do this. But if you're marketing a clinic, that's just a little different. Good. So the solution to the luxury to making sure that your practice is speaking to a client's specific need is to communicate the relief you provide to clients. So instead of focusing on how beautiful your practice is, um, w- uh, w- focus on how well are you communicating the relief you provide. What kind of an image, for example, would communicate relief from arthritis? And also, who is likely to have arthritis? Is the client likely to be a beautiful young woman with a flower in her hair sitting on a massage table, or an elderly person, right, who has arthritis? So you're going to be thinking about that in your branding and in your imaging. It may be far more successful to you to put an elderly, beautiful elderly person who has arthritis in your marketing than a half naked, beautiful young woman sitting on a massage table with oil going down her back.